The CDC Advisory Committee on Immunization Practices has voted unanimously to add the mRNA-based COVID-19 shots to the vaccine programs for children. That is the subject of today's episode. And so, from TrialSite News, I am Adrian, and our episode is starting right now. So, the Center for Disease Control and Prevention Advisory Committee on Immunization Practices, or the ACIP, represents a committee within the federal public health agency that was originally designed to offer up, in theory anyway, sound advice and guidance on effective control of vaccine-preventable diseases in the civilian population of the United States. In a unanimous decision, 15 ACIP members voted to add the COVID-19 mRNA vaccines to the agency's Vaccines for Children, otherwise known as the VFC program. Now, technically, this group of primarily scientific and/or medical experts are not political. However, they are chosen by the U.S. Department of Health and Human Services, Xavier Becerra and team. Xavier is an attorney who, of course, could be considered by at least some as a political appointee who worked his way up the Democratic power structure in California. With the unanimous vote based on the premise that the COVID-19 vaccines are safe and effective, and that the risk-benefit analysis with the advent of Omicron variant hospitalization numbers justified the move, the ACIP recommendation goes in front of Director Rochelle Walensky and the US HHS for approval. And it is highly likely that Walensky and the HHS will simply rubber stamp the ACIP's unanimous decision, one that represents a significant milestone in progressing the inclusion of both Pfizer-BioNTech's Comirnaty and Moderna's Spikevax vaccine in a routine immunization program. Now, while the federal government doesn't directly require local schools to mandate such a vaccine, the state level are the ones that get to decide vaccination requirements for schools, this, my friends, is still a big move. The ACIP's committee's unanimous vote all but ensures that these mRNA vaccines will at some point become part of the routine vaccination program, at least in many states, once they are formally approved for the youngest age cohort. While states do not have to comply with the CDC guidelines, their ultimate avoidance could in some circumstances trigger significant implications. This could include impacting federal funds for public health or even education. It is a tool that the federal government has often used to ensure that states follow their directions. You want their money? Then do what they say. Now, I should also include that in this latest saga, the CDC did share some disturbing data involving COVID-19 Omicron hospitalization rates of children, which they are using to shore up support as to why these recommendations should take place in the first place. Now, naturally, the internet and news media were abuzz at the decision. In fact, some Republican-led states announced that they, at least in their states, they wouldn't follow such guidance in the form of mandated school immunization. An example of this would be Joseph Lopito, who recently caused a stir by his recent study suggesting that the risks of the COVID-19 vaccines don't merit any mandates for young persons. He tweeted on this latest development by saying that, quote, regardless of what the CDC votes on, whether the COVID-19 vaccines are added to routine child immunizations, nothing changes in Florida. So let's take a look into the CDC vaccine work group process. Now, while at TrialSiteNews.com we'll have a more in-depth coverage of all of this, for the purposes of this YouTube video, I'm going to highlight on a couple of major points. First, they dealt with the effectiveness data associated with COVID-19 mRNA vaccines and pregnancy. Sasha Ellington tapped into a large meta-analysis published in the BMJ called the Clinical Manifestations, Risk Factors, and Maternal and Perinatal Outcomes of Coronavirus Disease 2019 in Pregnancy, Living Systemic Review and Meta-Analysis. Ellington took the other members and public viewers on a tour of pregnancy-related data via multiple sources, demonstrating that A, first and foremost, pregnancy was a risk for severe illness. B, the novel coronavirus is associated with increased risk for complications and adverse pregnancy outcomes. And C, infants born to people with COVID-19 during pregnancy are at higher risk for adverse outcomes. Now, they based this primarily on data from the Vaccine Safety Data Link, or VSafe, and a national survey called the NIS ACM. which is powered by complete and ongoing studies delving into COVID-19 vaccine safety in pregnancy. The basis for many decisions is based on limited studies, including these. You've got the JAMA Network, spontaneous abortion following COVID-19 vaccination during pregnancy, the New England Journal of Medicine with their evaluation of acute adverse events after COVID-19 vaccination during pregnancy, and finally the CDC's receipt of COVID-19 vaccine during pregnancy and preterm for small for gestational age at birth. All of these you can find at their respective sites if you want to read up on them. Now, problematically, many assumptions go into the data, often observational and subject to biases. For example, the vaccine booster data is now being generated in clinical trials that have many months yet to go, meaning things could be subject to change. Not necessarily that they will, but that they could. The CDC Vaccine Working Group, based on ongoing studies involving Health Partners Institute, Yale University, and Kaiser Permanente Center for Health Research, concluded that A. COVID-19 booster vaccination in early pregnancy was not associated with increased risk for spontaneous abortion, and B. The vaccine safety data link is continuing comprehensive surveillance of COVID-19 vaccine safety in pregnancy. While none of this data are complete for the bivalent booster dose, the CDC concludes thus far that no safety signals have been identified, meaning it's all right to proceed, and that they are certainly conducting future studies to evaluate long-term outcomes and newer COVID-19 vaccines. Now, this of course represents an unorthodox approach to say the least, and highly concerning, given the scarcity of clinical data. So this of course begs the question, what is driving the CDC's pregnancy and COVID-19 vaccination logic here? The Vaccine Work Group concluded that the unfolding data in VSafe COVID-19 Vaccine Pregnancy Registry only adds to a growing body of evidence that the COVID-19 vaccines are safe during pregnancy, and the CDC can find, quote, no evidence of increased risk for participant or infant outcomes. Yet, the Public Health Agency acknowledges that they must expand their analysis to a full registry cohort, while acknowledging considerable limitations in underlying studies. They point out that the agency will continue to monitor the safety of COVID-19 vaccination during pregnancy with an extended follow-up through 15 months post-delivery. Which then leads me to a point that we here at TrialSite News have repeatedly pointed out, that the regulatory labels of both Pfizer and Moderna are telling a very different story when it comes to pregnancy. There is no certainty of safety at this point. So why is the health communication arm ahead of the regulators? Which then leads us to children and the disturbing COVID-19 hospitalization data that the CDC covered in this meeting. Sarah Oliver of the CDC Vaccine Working Group presented COVID-19 vaccines in children and put forth data on a disturbing surge in COVID-19 related hospitalization of children aged 0 to 4 years of age. Of course, the total number of children hospitalization figures remains far lower than the elderly or other age groups. It is also worth pointing out that as previous research has shown, the underlying health of young persons could be a significant risk factor for hospitalization. Children with obesity, for instance, are at a higher risk of more severe illness. Furthermore, it is difficult to know the number of children who have already been infected by SARS-CoV-2 and have some level of immunity, as many of them may not have been reported or documented. And as of now, the risk of severe illness in this cohort still remains low. It is also worth pointing out that as far as child deaths are concerned, it is not clear if anyone has passed away directly due to SARS-CoV-2. In most cases, these rare deaths have involved serious comorbidities. Which then leads us to the question about myocarditis. It is an identified cardiovascular safety signal that has been acknowledged by the FDA and CDC as a potential risk. The CDC Vaccine Work Group acknowledges that both myocarditis and pericarditis are primarily observed in young adult males, but they identify it as a rare occurrence, and they went on to argue that the risk of adverse cardiac outcomes were 1.8 to 5.6 times higher after SARS-CoV-2 infection than after mRNA COVID-19 vaccination among males aged 12 to 17 years. Of course, some experts and critics have questioned the ethics of framing an argument around myocarditis from a virus a child gets versus a vaccine a child gets. Research is still being gathered on myocarditis as a potential condition from the COVID-19 mRNA vaccine, as well as how much the current COVID vaccines protect a child from getting COVID-19. Now, in response to this, a large COVID-19 vaccine injury group called React-19 produced their own report in response to the CDC ACIP meeting. The group is challenging the CDC's position that the benefit outweighs the risks of the COVID-19 vaccine when it comes to the vulnerable child population. They made a point to remind everyone that side effects do actually happen. And in the case of the vaccines, if they do occur, there is little to no help in this current environment. They point out that there is no drug company liability thanks to the PrEP Act emergency declaration. And they also argue that according to the CDC sources, 86% of children have already had COVID-19 and hence have some form of natural immunity and thus reduces the risk from the virus and the imminence for vaccination based on risk considerations. The group also points out that the overwhelming number of children that get COVID-19 experience asymptomatic, or no symptoms, or mild symptoms. And they point to Johns Hopkins University data, which suggests that although only 16 to 29% of the child population have been vaccinated, mortality for this group remains statistically at 0.00%. Now, going back to the recent CDC ACIP presentation, they claimed that over the past half year, during the Omicron period of the pandemic, a little over 250 children have died. However, it is still not clear how many of these children have died directly due to COVID-19. It is also worth pointing out that during the 2019 flu season prior to COVID-19 becoming the focus of the world at large, the CDC reported that 188 children have died in association with influenza, which then begs the question, why wasn't the flu shot required by most schools? Now, interestingly, the vaccine injury group, React-19, reported their own numbers based on the two cdc.gov websites, which reported 32 deaths from ages 0 to 17 in 2022 from the CDC tracker, and 26 deaths ages 0 to 17 from the CDC's VAERS reporting system. Now, this seems to contradict the CDC vaccine work group, which referred to just over 250 deaths during the Omicron period, so it's not entirely clear which numbers are correct here. But the React-19 numbers do refer to authoritative source databases. In any case, the CDC has decided that the risks given this ongoing emergency necessitate ongoing mass vaccination of all children that have yet to be vaccinated, regardless of natural immunity status. So the question still remains, why? Well, to get a better view of their public reasoning why, the CDC ACIP's stance as to why is as follows. First, both BNT162b2 or Comirnaty and mRNA-1273 Spikevax are proven as safe and effective based on the unfolding data, this according to the CDC. While COVID-19 impacts adults at significantly higher levels than children, since Omicron, a material surge in child hospitalization raises the risks associated with opting not to vaccinate, the number of deaths associated with COVID-19 in children are also factored into this decision. Again, the CDC says over 250 children have died from COVID-19 in this last half year. And once again, it is not clear if these children passed away due to COVID-19 directly, but there you have it. Now, while technically there is no direct clinical data yet to back the ACIP's decision to advance the bivalent Omicron booster vaccines, a risk-based platform framework paradigm offers the basis for the presumption that they are safe and effective. And then the CDC is relying on real-world data, pointing to better outcomes for both children and pregnant women and babies versus the risk of COVID-19 alone. So now let's focus on some of the real concerns about this vote. It represents the first time the ACIP has voted for a childhood vaccine product that lacks robust completed clinical data. With only mice data to date on the updated product, again, specifically for children, one could argue that the FDA and ACIP are bypassing full clinical data for children. Also, an interesting note here, over the summer, the HHS purchased 66 million doses of the Moderna mRNA-1273 and 105 million doses of the BNT162b2 mRNA-based product for a total of 171 million doses. They did this prior to the FDA authorization and the CDC recommendation, as this, of course, only just happened, with again arguably limited data, which makes it appear that these purchases were calculated. And then you have Moderna CEO Stéphane Bancel on the record during a Yahoo Finance 2022 All Markets Summit, who said that the COVID-19 booster market will probably become just like an annual flu shot moving forward. So what about the TrialSite news point of view here? Well, We here at TrialSite News have chronicled that to date, among eligible persons nationwide, less than 5% of Americans have received the bivalent Omicron booster dose. This, to us, seems like an overwhelming rejection of this particular booster dose. We suspect that the only way that this percentage will significantly increase is if one of the potentially more dangerous Omicron variants shows up in force, or if there are mandates at the level of schools, the workplace, and so on and so forth. And while the CDC's move recently doesn't directly lead to a mandate, once the recommendation is in place, many states, health systems, and school districts may very well make it mandatory. Now, speaking on this matter, TrialSite News founder Daniel O'Connor opined on this troubling situation brewing, saying that when was the last time the flu vaccine was forced on 5 to 10-year-olds as part of a school vaccine requirement? The federal government involved with this effort faces pressure, as they must figure out how to drive demand in a population that's figuring out how to transition to the endemic stage ahead of the government themselves. Even Joe Biden declared the emergency was over, thus contradicting his own policies of aggressive vaccination push. So let's recap here for a moment. The CDC ACIP panel voted unanimously 15-0 to recommend the COVID-19 vaccines and boosters for increased access to children via the Vaccine for Children program. There will be subsequent meetings involving the process and authorization to add the COVID-19 mRNA vaccines to the childhood vaccination schedule. Assuming that the CDC and HHS move to include it on the schedule, there are going to be issues of liability and vaccine injury compensation, which are going to persist due to existing rules and laws. But considering the products, the bivalent booster, are still under EUA status for the youngest age group, is it right to include such an investigational product on a vaccination schedule? Given the latest booster percentages and surveys on trust in the government and public health agencies, it is fair to state that sizable percentages of the public grow ever more frustrated with the regulatory process, not to mention leery of too much pharmaceutical company influence in public health policy. There is a combination of fear, industry pressure, and possible regulatory capture, not to mention politicization during COVID-19 that is contributing to waning trust in what used to be highly regarded public health-focused institutions. What happens next is anyone's guess, and of course, we here at TrialSite News will be keeping an eye on this story as it continues to develop. And that, my friends, will bring our episode to a close once more. As always, thank you so much for joining me on the program today. From TrialSite News, I am Adrian, and I will see you all next time.